Welcome back to the Black Health Lit podcast. This is a space where we can be black, proud, and healthy. Today's episode is focused on vitamins and supplements. As a reminder, the Black Health Lit podcast is for educational and informational purposes only and does not constitute providing medical advice. Make sure you like, subscribe, and share this episode. Also, while you're here, check out the show notes and episode description to learn more about Dr. Hall and shop Black, Proud, Healthy merch. Welcome back to the Black Health Lit podcast. Today I have the pleasure of talking with Dr. Greg Hall out of Cleveland, Ohio. Before we jump into today's topic on vitamins and overall wellness, can you go ahead and introduce yourself to my audience?
Sure. Yeah, I'm an internal medicine doctor, which is like a primary care doctor. Been working in Cleveland for 30 plus years. I've got like 90% of my patients are Black, so I've been seeing a lot of this. I wrote the first book on the clinical care of African Americans called Patient-Centered Clinical Care. It's for providers, it's for doctors and nurse practitioners to give them best practices on how to treat African Americans and to our advantage, right? The real facts, the research-driven facts about best practices in treating us. So, and I'm currently the medical director of the Cutler Center for Men at University Hospitals in Cleveland, and we've just established University Hospital Center for African American Health. We can talk about that as well.
Ooh, I love it. I can't wait to hear more about that. So let's talk a little bit about vitamins. I take vitamins daily. I use the vitamins that you came up with. I've used which other brand? I've used Nature's Made in the past. I've used One a Day. I did Flintstone vitamins when I was a kid. So talk to me about why would someone, an adult, we're going to focus on adults today. Why would someone take a multivitamin?
Well, usually, I would, maybe 10 years ago, I would say if you have a good diet, you probably don't need to take a multivitamin. That's what me not knowing the stuff I know today, that's what I would have said. And that's what a lot of providers, a lot of doctors still say that if you have a good diet, you don't need to be taking any multivitamins. But after I've sort of did the research for the book, when I was writing the book, I was doing a chapter on lab results, differences in lab results, which there are some. We tend to have more anemia. We tend to have more magnesium deficiency, more potassium deficiency. And so when my patients would go to the ER, and I'd say, well, what'd they do? For whatever, chest pain or something. I say, what'd they do? Well, they gave me some potassium or they gave me some magnesium. I'd hear that over and over again, but it never really clicked until I was doing the research. And I was like, oh man, African Americans tend to have potassium deficiency and magnesium deficiency. I knew about vitamin D deficiency, but I didn't know it was so dramatic. So the recommended daily amount of vitamin D for a white person is 600 international units.
Okay.
For African Americans, it's 2,000. So that's the daily amount to maintain your vitamin D. If it's deficient, you need even more. So as I was writing that chapter, I was like, wow, I could do a multivitamin that would actually address our deficiencies, which is different from making one to address the deficiencies of white Americans who are totally different. So like 80% of African Americans are vitamin D deficient compared to 20% of white people. Right. So it's a dramatic difference. And here in Cleveland, everyone who I check a vitamin D on is deficient. Everyone, unless they're on a supplement, they're deficient. So it's like across the country is 80%. But, here in Cleveland and Chicago, Pittsburgh, those people are all vitamin D deficient and not know. And you can only get vitamin D from the sun and milk.
Yeah.
And so we don't go outside nor do we get a lot of the sun in places like Cleveland and Chicago. And we don't drink milk because we're disproportionately lactose intolerant. So you need to take some vitamin D, at least, whether you take my multivitamin or not. You need to take a vitamin D every day or take a mega dose once a week or, something like that. And there's a ton of stuff we can talk about that's associated with vitamin D deficiency that I didn't know. I thought about bones and stuff, but vitamin D deficiency is associated with breast cancer, colon cancer, prostate cancer. So, Black people have the highest risk of all those things, right? Breast, colon. So it's like, wow, is that coincidence? I don't know.
Yeah. My PCP put me on vitamin D probably about 3 years ago. And when I walked into her office, it was my first visit with her. She said, we're gonna get some labs on you. And she said, I bet your vitamin D is deficient. And it
Right.
was.
Yeah, I bet that on everybody too, and I'm right. I'm always right. And so it's what they haven't shown is a direct that people, when you replace that, we prevent it. I hope that that's true. I hope I don't get prostate cancer or lung cancer, colon cancer. You know what I mean? But I'm
Right.
that's not hedging my bets. And so and what's good is that your doctor told you that, but there's so many people who see Black people and vitamin D deficiency is not even on their radar. They're not even
Yep.
thinking about it. So that's why when I talk about having there be more Black doctors, right, so that we can treat, because then we know what we tend to get, right, and it's true. Jewish people tend to know what Jewish people get, and they screen them for it, right. So whatever you see, Native American doctors know what Native Americans get, so they screen them for it, and so that's why it's important. I think it's important to have a Black doctor or a person who is at least trained in the best practices of treating Black people, which there's not a lot of people that brag about doing that, but I do.
So tell me a little bit, Dr. Hall, about the differences between vitamins and supplements. Is there a difference or are they the same thing?
Well, a supplement is supplementing what you eat, right? And so we get our nutrition from our diet and our activities, right? So when you think of a supplement could be a vitamin, it could be a mineral, it could be any substance that's supplementing what you eat. So when you say, we could say multivitamins or supplements, you could say minerals or supplements. And so when we say GNetX Sequence Multivitamins and minerals, right? Because potassium and magnesium in there. And normally in a multivitamin, you don't get potassium and magnesium because most white people aren't deficient in potassium
Right.
and magnesium, but we are. And so ours has those vitamins and those minerals. And those are all considered supplements. But I think the part that made it that I really needed to devise a multivitamin just for us was the
Yeah.
fact when I learned that vitamin E was potentially bad for us. That vitamin E increased men's risk for prostate cancer and for lung cancer, and that selenium increased their risk for that. And I was like, wow. And I look in my cabinet and there's a big bottle of vitamin E, right?
Absolutely.
At exactly the bottom. Someday I'll take some vitamin E. No, because vitamin E is not good for you, particularly men. Women aren't going to get prostate cancer, and that's the best evidence that shows it's connected to that. So I actually tell men over 40, don't take a multivitamin. You just need to take vitamin D, zinc, magnesium, a little bit of potassium, and some vitamin C, and you're probably fine. And so once you've done all that, it's cheaper to buy my vitamins, what I mean,
Yeah.
than to buy all the things and then not have it, because it really is not good as you get older to take just a multivitamin, because number one, it doesn't have much vitamin D. It'll say 100% of the vitamin D you need, but no, it's 100% of the vitamin D a white person needs, which is 600. It's not 100% of what a Black person needs, and so that difference is just the way it is.
Yeah, yeah. That is very informative and enlightening. Talk to me a little bit about zinc. I
Mhm.
know as Black people, we love elderberry, we love zinc, we love vitamin C. We think that it can cure any and everything that can ever hit us. So talk to me a little bit about what are the health benefits of zinc?
So zinc is really important too for a number of different reasons. People conventionally think about it their immune system. And so again, if you look at the data, African Americans have the highest risk for catching an infection, right? Highest risk of getting the flu and being hospitalized for it. The highest STDs, right? All infections by far. And so I was writing an article on STDs. It's ridiculous how
Yes.
high STDs are in African Americans compared to who's in second place. But we're not having that much more sex. You see what
Right.
I'm saying? If you're not having, we should be having dramatically more sex in order to have dramatically higher sexually transmitted diseases. But
Yeah.
we always connected to sex. We're kind of data. But if you had your immune system intact, a lot of people wouldn't catch stuff. You know what I'm
Oh,
saying? It's your immune system. People come over your house and cough and sneeze, and you don't get sick because your immune system keeps it. Sometimes they come over and you do get sick. right?
Yeah.
But the difference is your immune system fights off all diseases, COVID, HIV. So African Americans, again, the highest HIV rate, the highest COVID rate, the highest STD,
Yeah.
and so and that's all not because we don't wash our hands, or you know what I mean, or it's because our nutrition is poor, and that related to our immune system. And zinc fortifies our immune system. And it's
Uh,
one of the things, like when you're catching a cold, you take those Zycam or something. That's zinc. Really,
yeah.
it's just it's overpriced zinc, and it'll
Oh,
help you fight that infection off before it takes hold. And that's, data has proven that. So if you just keep your zinc levels up, you should be at the best opportunity to fight it off. Even
okay.
related to bacterial vaginosis, there's over 50% of Black women of childbearing age have bacterial vaginosis. And again, this widespread zinc deficiency, people have written about it, that might be the cause. Is related to a zinc deficiency. So really, we should be taking extra zinc, 15 to 20 milligrams of zinc a day there, or getting the things that are high in zinc. You know what I
Yeah.
mean? And so I'm all for those elderberries. Healthy stuff is better than taking a supplement. Eating Alaskan salmon, is better than taking a tablet with vitamin E, or all those other supplements that we take. But
Omega
we don't
3.
always, right, omega-3s, but we
Those
don't
two.
have the time. We don't have the time to make Alaskan salmon. You know what I mean? Or all the things that we need.
Yeah. I started zinc. I've never taken zinc separately from like a blend of vitamins, but this season, this I've heard this is supposed to be a really challenging season for COVID and
Mm-hmm.
flu and pneumonia. And I said, you know what? Let me incorporate some zinc this flu season, and maybe I'll keep it in my regimen indefinitely. But especially during this flu season, something in my spirit said, you need some zinc.
Well, and maybe you do, but the point, if you're taking my multivitamins, GNetX Sequence Multivitamins, it has the zinc that you need, and it's way more zinc that's in, the name brand multivitamin. So the idea behind the vitamin was to make sure so you don't have to have a cabinet full of
Right.
zinc and vitamin C and magnesium and potassium and vitamin D. That was
Yeah.
the thought, that if and I think that is why people are reporting all these dramatic things, which, it's a multivitamin. I don't feel dramatically different. I've been taking it for 2-3 years, right? I don't feel
Yeah.
any different. I haven't gotten sick, but I don't feel much different, right? But there's people who report these dramatic things that I don't put in commercials because I don't want to mislead anyone, because it's a multivitamin, right? But it's because they've been deficient so long. They've been vitamin D deficient, they've been zinc deficient. It's like, oh my God, I feel, because their diet's no good. I talk to some of my patients, they're eating ramen noodles, and
Yeah.
that there's no nutritional value in that stuff. So really, when you take this, people can see dramatic differences because they're so deficient in the things that we need in order to be healthy.
Yeah. I can't say that I feel better when I take vitamins, but what
Mm-hmm.
I can say is, if say I go on vacation and I forget my vitamins,
Mm-hmm.
I'm exhausted. I notice a dramatic change in my energy and
Mm-hmm.
in my mood, aka grumpiness, when I don't take my vitamins. I
Mm-hmm.
notice like a decline, not so much an improvement in my health with or without the vitamins, for sure.
Right. Well, that I like I said, I've always have them with me because I'm always trying to sell them to people.
Yeah.
Showing the people, here, you need to take these here. But I get it, but I haven't been off of it long enough to see a difference,
Yeah.
off of it. But I could not swear in a court of law that I feel anything different, what I
Yeah.
mean, on them. But
Yeah.
when we have a new set of commercials coming out, and we had 10 people come and give to not paid. These are just volunteer people come, and they were just like, it's amazing. I feel great.
Amazing.
Yeah, and I was like, I'm not paying you, and we won't. None of that stuff I think is going to make the commercials. They just talk about customer service. I'm not trying, get killed,
Right.
get sued, or anything behind doing anything illegal. But
Right.
people are saying amazing things, and we've sold them in all 50 states, Alaska and Hawaii, which is crazy to me that black people live in Alaska, but they
Yeah.
do. And they're buying the vitamins in Montana and Utah, and it's like wow. And really, a lot of it's just through word of mouth. We don't have the money to be on, on Tamron Hall or or anything like that. So we just been it's been like the slow grow, word of mouth, things of that nature.
That's the best kind, especially at the beginning, because that you have a nice, strong base of customers who will be good testimonies.
Yeah, well,
You know?
we definitely have that, but it's just when you buy them in bulk and you got to have all these many thousands of dollars to buy so many bottles. I'm like, I wish we were growing a little bit faster.
Yeah, yeah. So you touched on it a little bit already. You mentioned vitamin D, zinc,
Mhm,
magnesium. What
Potassium
are the and potassium?
and vitamin C. That if you were say you're like, I'm not going to buy it. I've got all this stuff in my cabinets. You would take vitamin C, vitamin D, zinc, magnesium, and potassium. That's what
Okay.
you would take. And then
Okay.
you're probably fine, because some of that stuff you don't need. And so I tell people, like, when you were taking, I used to take Mega Men, and then when I would go and pee, it was like, whoa, it's like this orange, like what the hell? My God. And it was startling. You know what I'm saying? But
Yeah.
that's all the excess stuff you don't need. And so
Oh,
if you think about it, when you take genetic sequence multivitamin, that's a big multivitamin, and you take it, there's no change. There's no change. There's no glow to
yeah.
to your urine, which is like you're getting what you need, but you're not getting what you don't need, because the other thing we didn't talk about was vitamin K. So
Ooh.
vitamin K causes your blood to clot, right? So that's when we cut ourselves and it scabs over and heals. That's vitamin K that does that, right?
Yeah.
There's no evidence when I was doing research that we tend to have vitamin K deficiencies, but we do have the highest risk of stroke, clot in your head, heart attack, clot in your heart, DVT, blood clot in your legs, peripheral vascular disease. So if
Yeah.
you don't have a deficiency in something that causes your blood to clot, and you have the highest risk of clotting, and that's all objective evidence and research confirmed, then why would you want to take something that has extra vitamin K in it? There's there's,
Exactly.
there's no reason to. I mean, there's no deficiency, and we're already clotting our butts off. I mean, we're
We
clotting.
don't need black folks don't need help with clotting.
No,
Generally speaking, that's the last thing we need is more clotting.
more clotting. No, absolutely. And so now, to be honest, there's no evidence that taking extra vitamin D causes your blood to clot.
Okay.
There is no evidence to cause that. But I was like, if there's no deficiency, why put it in there? And no one's
Yeah.
really doing a whole lot of testing on us. You know what I
Right.
mean? So we don't know whether it does or not. So I just left vitamin K out because there was just no reason to have that extra risk. And
Yeah.
and like I said, and this is where no one has ever sat down and put together a formula for Black people looking at, right, how do we best maximize the health risks, or minimize the health risks and maximize the health benefit of a supplement. It's crazy to think I'm the first person to do that, which is crazy to me, but I am. And so what happens when I tell people we're not just a Black owned multivitamin, which we are,
Yeah.
but they just put your label on regular multivitamins, and then you're
Yeah.
sister girls multivitamins, right? But it's the same multivitamins one a day. And so what
Yeah.
we're doing, and I know someone's going to copy us, because it's a common sense approach, quiet as it's kept. You know what I'm
Right.
saying? So someone else is going to do it, and then I won't be able to say we're the only one. But
Right.
but we are the only one, and I want people to start thinking about our Black health, thinking about how do we actually maximize what we're doing, what I mean, for health, rather than really just trying to make a profit and say support a Black company, which I support Black companies
Yeah.
anyway. But for this,
Absolutely.
it's like let's really use our brains when it comes to how do we make it best for them.
Right.
Let's see what we can do about health disparities, about all this sickness, all these infections, and we
Yes.
can make people healthier.
Yes. Yeah. That was a lot right there. And there's so much to unpack. There's the lack of research um, that is specific to Black Americans, African Americans. There is health and wellness resources or supplements or vitamins out there that are not tailored to us besides what you're offering. Then on top of that, we have literacy, which is a challenge in our community, especially. So there's a lot of things working together that can make us have these far worse health outcomes, the infections, the HIV, the bacterial vaginosis, the prostate cancer, all of these things that Black people are have a higher propensity, or if we don't get it more, we die more when we do get it. Like it's a lot. But vitamins is a good start to just achieving overall wellness, in my opinion. Um,
And
Obviously,
and the evidence shows that, right? It's a great start. Nutrition, I guess what really is a great start is
yeah,
nutrition, right?
yeah,
Nutrition and exercise. And talk about if you want to prevent a whole lot of disease, make sure what you eat is good and
yeah,
make sure you exercise. That's the great thing. And so what the problem is our eating. Our eating is not good. And so that's why we don't eat enough fruit. That's why we need vitamin C, right?
yeah,
We don't eat enough greens. And that's why we need zinc. We
yeah,
don't need, you see, you can tie all these things. We aren't outside in the African sun.
yeah,
That's why we need vitamin D, right? We're
yeah,
not working, we're not exercising. So that's why we're not getting the sun. So so God did not put on this earth for us to take a multivitamin. You know what I mean?
right, yeah,
Or to, he didn't, that was not in the master plan. But because we're doing what we're doing, our ancestors moved to North America or brought here or whatever, and we're now in the house, we're not outside working, and
you're on a computer.
we're on the computer. Yeah, so because of all that, we have to make adjustments in what we do in order to make sure we're living our healthiest life. And
Yeah,
so, and then again, Alaskan salmon is expensive. You know what I'm
yeah.
saying? And
And if you're
so
a family of four or a family of two, three, four, five, six, you
it's
just
it's
trying to
it's,
try to
it's
get to the next day.
absolutely. And then it's in the food deserts in some cities, where I grew up in the inner city of Cleveland, there was no really grocery store that you would get anything, really buy anything out of. You know what I'm saying? There was a grocery store, but we never bought anything from it. My mother wouldn't go in there, right? So
Yeah,
it was like we had to kind of make do with things, and people are still making do, but our attention has gone off the fact that nutrition and exercise is the key to long life, right? And so and so exercise, you can't make up exercise. There's no pill for exercise, but there is a pill for some of this nutrition, right? Some of it.
yeah,
And I actually say that you can't just take the pill. You have to take the pill with a meal. And so
yeah,
and that's how you maximize your body thinking you're actually eating something healthier than what you're actually eating. So you
yeah,
don't wake up in the morning and take a multivitamin and keep moving. You're not going to absorb a lot of that stuff, but you've got to have a reasonable meal and then
yeah,
take it with that.
yeah. Agree. Should people check with their doctors before starting vitamins, or is it okay to go out and say I'm going to start these vitamins?
Well, I'll tell you, the bottle says check with your physician. So the lawyers say that you should check with your physician.
Yes.
Again, so and I'm not trying to get sued over things. There are people that may have a certain situation. There are people that might not have a clotting problem and need some vitamin D, or or
Yeah.
maybe they're already taking something, some stuff, and then they add this in and it's no good. Or maybe if you're on dialysis and you're not excreting potassium like you're supposed to, then the
Yeah.
extra potassium in the multivitamin might be bad. So they would know what sort of conditions you have. And so if you were in that special situation where you didn't need X or Y that's in there, then your
Yeah.
doctor would be able to tell you that. But of
Yeah.
course, by and large, who does that? No, people don't very rarely come to me and ask, "Can I take this vitamin?" You know what I
Yeah.
mean? But that's what the label says, and it's certainly reasonable. If you have any health issues, it's best if you check with your doctor first.
I agree. story. I had to check with my doctor. Now, prior to cancer, I would just run out to Target, Walmart, CVS, get it, whatever it was I was
Mm.
taking in that season of life,
Right.
biotin, vitamin C, whatever. But after you have cancer, you're a little more cautious. And
Mhm.
one of because my breast cancer was hormone receptor positive, part of the treatment for that is playing with my hormones.
Mhm.
I'll just keep it simple for
Right.
people. But one of my girlfriends was like, you need to get sage. It helps with some of the side effects of playing with a woman's hormones.
Hmm.
And yeah, with hot flashes and mood and things like that. So I went to my oncologist. I was like, my friend said take sage. And it was one other supplement I can't remember. He pondered, he's a researcher. It was my oncologist, and he says it may make your body think that it may like mimic hormonal treatment. It wasn't going to mimic the hormones, but it was going to like make my body think like, okay, you're more balanced than you are in this hormone. But he's like, I'm trying to make you go this way. The sage might make you go that way, to keep it very simple. And he's
Mhm.
like, not enough research. Let's stay away from that. And so I think more than anything, the medical doctor may say there's not enough research. Like, it probably is not going to harm you, but if there's a lack of research and you're dealing with a cancer survivor who you're trying to get to a 5-year survival mark,
Right.
I'd be like, no, that's okay. Don't do that one. But
Yeah, no, and that
vitamins he's good with. He's good with the rest of them.
yeah, no, I think it's definitely good to ask, have someone you can use as a reference for any question related to your health. I mean,
Yeah.
there's some things that are out there just aren't helpful. Like you say,
Yeah.
this I'm not big on, testosterone replacements. There's people that want testosterone, and that's what causes our, hardening of the arteries. That dries up your blood pressure. I mean, it's a, so how important is some men's erections compared to their overall health. You know what I'm
Right.
saying?
Right.
And so you have to balance, these things, and treating high blood pressure, bringing your blood pressure down. It's just like simple things that you can do.
Yeah.
But I always say it's like making a cake. There's ingredients and there's amounts of everything that go into having a successful cake, right? If it says 2 eggs, you don't put 5 eggs in there. If it says do this, you don't just overdo it, because you won't come out with the final ingredient. And so there's a formula to having a healthy body. It's not just drinking sage, or let's say, I tell you to take 15 or 20 milligrams of zinc, I'm gonna take 100.
Yeah.
So like,
We will do that.
yeah, no, you're like, okay, if 15 is good, 100 must be way better, but it's not. It's not. You can overdo it. You can have zinc toxicity. You can have vitamin C toxicity. You can have vitamin D toxicity where you had too much. So it's not. You need the right amount. You don't need too much. You don't want too little. You want the right amount. And we do that with everything except
Yeah.
for multivitamins. We go to the vitamin store and we just pull all that stuff
Yeah.
off the counter. Oh, this looks good. Let me take this and let me take that.
We
And
sure do.
it's not a good. It's not good. You know what I'm saying? You need to have a science. You need to run that by some people to see what they're actually doing.
Yeah, and not Dr. Google, like somebody who has MD or DO after their name.
Mhm, absolutely. Dr. Google is. I tell people is that if you whatever you know about, Google that and see what it says. And you'll see how accurate, it is. So I'm talking, I Googled and it says so and so. What do you know about? I say, well, you know about plumbing. Okay, so you say if I watch a YouTube video, I can just do the plumbing in my house. No. I can't. You know what I mean? I need a plumber.
Yeah,
There's a whole bunch of stuff you need to do. A plumber will do it. So follow that you can't just read about it. And more times it'll scare you more than anything, because I tell people the people who had success with something don't complain about it online. It's only the people who've had trouble with something. So
yeah,
people say, I don't want a hip replacement. I heard all kinds of terrible things about it. Because the people who had successful hip replacements are playing golf.
Yep.
they're not bragging about it online. It's the
Nope.
people that got an infection or the titanium work. Those are the people complaining. So you get this skewed view of what it is, and it scares a lot of people off. People are suffering because people are online complaining about something that really benefits the vast majority of people who get it.
And those are the outliers. Yes. You ready for some rapid fire questions, Dr. Hall?
Sure, rapid fire away.
Okay, I'm shooting. What does wellness mean to you?
I think wellness is being, not having to worry about a lot of things, right? Not have to worry about infection, having to worry about paying your bills, not have to worry about your kids, have to worry about getting shot. I think wellness is really the absence of worrying, sort of just being able to go through your day and try to help people and help
Yeah.
yourself and better yourself. I think that's wellness.
Okay. I like that answer. I like that you included gun violence.
Mm-hmm.
We often leave out the conversation, which I'm not going to go on a tangent here. I will try not to go on a tangent, but we often don't think about gun violence when we're talking about Black health and wellness.
And and we're gonna go on this little brief tangent because I can't skip it. I can't
Yeah.
skip it. The
Okay.
number one cause of death for a Black male age 1 to 44, number one cause of death for a Black man age 1 to 44 is homicide.
Ooh,
Homicide. That's the number one cause. It's not cancer. It's not heart attack. It's homicide. So my three sons in their 20s, their number one risk of dying is by getting shot, right? And
um,
that's all gun violence. It's all gun
yeah,
violence. And so this is a health related podcast. We cannot dodge around that. If you have a gun, you have a higher risk of getting shot than if you don't have a gun. That's
wow,
just a fact. I'm not pointing fingers. I'm just saying that's just
yeah,
a fact, right?
yeah,
And so people get in a fight and they're gonna go grab their gun, and
yeah,
now everybody's life is derailed. People are dead or wounded. I've got people in
yeah,
nursing homes, 25-year-olds paralyzed from the neck down, right,
yeah,
for the rest of their lives over a fight,
yeah,
which is or drug deal or whatever. So
yeah,
it's you've got to think about all these guns. It's just not healthy, and it's just
yeah,
not safe.
yeah. Live by the gun, die by the gun. So
True.
yeah, that is a very valid point, and I appreciate the tangent, even though we're talking about hey, anytime there's an opportunity to educate and highlight and say, hey, this is something that's harming or killing us, let's talk about it. So,
Absolutely.
why do you think, Dr. Hall, Black health literacy is so important?
Because that's the key. That's really, if you were going to say what the key to long life is, it's really is health literacy. I mean, that you really hit on the absolute key. And so I tell people that the people who live the longest are people with a PhD or MD like myself. They live longer than people with a master's degree, who live longer than people with a bachelor's degree, who live
Yeah,
longer than people with a college degree, a high school degree. And the
yep,
high school people with a degree live longer than people with a GED. And the
wow,
people with a GED live longer than people who don't have a GED, right? And that also, you can line that up with smoking. The smoking rates decrease as you go up with
yeah,
education. So even just if you want someone if you're 50 years old, if you get a bachelor's degree, you're just going to extend your life.
yeah,
You know what I'm saying? You can do it at night, Tri-C, or community college or whatever, but you'll extend your life. So as you learn more and learn about learning and learning how you never stop learning, and
yes,
that is what can extend your life. So really literacy in general, and then health literacy and specifically knowing and not believing conspiracy theories and just whatever the next door neighbor on the front porch said that wasn't helpful. You know what I
yes,
mean? And it just really trying to open your mind to experts and finding people that you trust. 'Cause there's not all doctors are for everybody, right? And somebody
right,
may tell you something bad. They may not want you to be healthy or want you to be better, but you find someone that you need to keep searching until you find someone that you trust, and then get their advice, right?
right,
because that helps. That's part of health literacy, listening to something like this and really finding out what the truth is versus kind of things you heard on the street, and then researching that, right? So they shouldn't take anything we say as gold. You know what I mean? You should say this should be a starting point where, let me go to the website, let me see what's behind this vitamin K thing, let me read more about prostate cancer. And
Yeah.
then, not when you think you have it, but when you're just learning about it, right?
Right.
And then you increase your health literacy. It is just so empowering, right, to be able to do that and know that, if someone's in your house smoking, that's really, really bad, and you need to get them to stop, right? Every day you need to be working on that. So that's all health literacy.
Yes, it is. It is. Well, thank you so much, Dr. Hall. You've been amazing.
Oh, thank you.
So enjoy our conversation. I don't think I said this at the beginning of the call, but if I did, I'm going to repeat it. I love the GNetX Sequence Vitamins. My family, some of my friends use the GNetX Vitamins. How can people learn more about GNetX Sequence Vitamins? You two have a podcast and you're doing a lot of work based out of Cleveland, Ohio. He is a Browns fan. Don't hold it against
Whoa,
him.
whoa, whoa, whoa,
Hooray, all day, okay?
whoa.
But we're not going to hold that against you. How can people learn more about you?
Well,
And your
you can go to my website, which is just been revamped. It's drgreghall.com. It's got a lot of useful information from a doctor standpoint on it. I have a podcast called Better Black Health. You can Google that. But if you go to my website, you'll see a link for that. I have a YouTube channel. I have Instagram at Dr. Greg Hall. And, so I'm out there. If you look for me, you'll find me. And I'm happy to help, be on having people on my podcast. I'm happy to be on their podcast, because this is the way we kind of get the information out. So I truly believe I'm just trying to make people healthier. I mean, I spent 25 years complaining about health disparities and not really doing anything other than complain about it. But this is an opportunity for us to see what we can do to try to actually move the needle on our health and extend our life expectancy, so we can stop going to all these funerals and people not having grandparents and stuff like that. It's ridiculous, and we can do something about it. We just have to work together.
We absolutely do. Well, thank you so much again. I will put your website, podcast, everything, link to GNetX Sequence Vitamins in the episode description, so people don't have to go looking for it. They can just look at the episode show notes and find it there and click it and get straight to you. So thank you so much. It's been great.
I appreciate it. Thank you.